Hello, I'm Dr. Jennifer Hanners Gutierrez. I'm a medical speech language pathologist and also a clinical assistant professor for the Texas Tech University Health Sciences Center School of Medicine. I am also executive director of the Storyteller the World, a nonprofit organization dedicated to global collaboration and education. Today, I want to offer some treatment methods for how to work with a loved one following stroke. I'm going to talk specifically about the left side of the brain. There are all kinds of things all of the time going on in the brain, and future videos that I will do will address alternative sites. But for today, we'll stay in the left. When we think about the front part of the brain, I do want you to know some key things done in that area. The front part of the brain controls pre-organization and organization of thought. Also fine motor skills. Also impulsivity control and regulation of personality, just to name a few. And if we move over into the left front part of the brain, the left front part controls production of speech, how you're able to say and produce words. So if your loved one has had a stroke in that area, you may notice things like non-fluent speech, labored speech, groping for sounds, groping for words. You may also notice that if your loved one is able to produce a word, they can't get off that word. It's like the brain gets stuck on that word. And your loved one says that word over and over. The hard part is also that in a lot of cases, when a stroke has occurred in that area, and if that stroke doesn't extend further back into the comprehension area of the brain, then patients or your loved ones understand what's going on around them. They understand the setting, they recognize you, they know what you're saying, and it becomes quite frustrating and sad to them that they can't talk to you. Imagine what that would be like. So it becomes our obligation to try to help patients and loved ones communicate. Today, I want to offer just a few things. One thing that is sometimes helpful, if you notice your loved one trying to get words out and they just can't say the word, give them the first part of the word. So let's say you hold something up in front of them and you ask, "What is this?" Can you say it? Let's practice. Can you say this? And cup or drink, you can tell they just can't say it. Give them the first part, like ka. It's a ka. It's a dr. That's called phonemic cueing. Another strategy that you can use, because these are just strategies designed to extract the words, right? To help them get it out. You can explain what it is. Now they know what it is, but it's like you're gearing them up to say that word. So you say, "Oh, this is what you use to take a drink of your favorite soda. This is what you use to drink your coffee. It's called a ka." So you're giving a functional cue, and then you're giving a phonemic cue. Another thing that you can do is help them by giving them alternative ways to ask for something. So if they struggle to say the word, tell them, each time you want a drink, use a gesture like cup. If you want something to eat, use a gesture like I'm hungry, I want something to eat. Another strategy is to be patient and give them options. If you know they're trying to communicate with you about something specific, like family members on a picture board, and they can't get the words out, then be patient and try to help them through that moment. Show the pictures and then say, this or this. And if they indicate one certain picture, you can help them. Who is this? Is this your si? Is this your ma? Giving the first part of the word, trying to cue them into that production of speech. Communication boards are also useful in this way. Putting pictures of different items that they regularly ask for so that it's not quite so frustrating when they really need something. The more you challenge your loved one to practice trying to say words, and if they're in a conversation and they get stuck, like, oh, hi, I've been looking forward to seeing you. Today and they're stuck. Don't try to fill that in. Let's say the therapist came. So you know what they're trying to say. Give it a moment and then try to help them say it. Like, are you trying to tell me something that happened today? Did the therapist? And maybe they got it. Oh, the therapist came. Or you can give them options. Are you trying to tell me something that happened today? Wait for them to tell you, okay, what happened? Did your doctor come? No. Did your therapist come? Oh, great, your therapist came. Tell me about that. And get them back into the conversation. The brain and plasticity training toward speech require that you challenge a patient to do the activity that is hardest so that you can recover that activity. It's very hard on you as a family member or friend, and it's hard on the patient or your loved one. So also recognize that as you do these different things, that it will become frustrating for your loved one and they will need a break. Never ever laugh if they say something wrong. Having a stroke in that area sometimes creates situations where the wrong sounds come out and the wrong words. So let's say they want to say spoon, but they say fork. Having a stroke in the front part of the brain, either side, can create situations where impulsivity is lessened and whatever your brain has heard over time comes out. So you may have a person who has never cursed say a bad word. Never laugh because they can't help it. It's embarrassing and it is demeaning to them if you feel like their situation is funny. That is something that is very important. If they do switch out a word like fork for spoon, redirect that. Oh, you need spoon. Or even better, if they can say it, oh, you need the other utensil? What is that called? What is that called? Let me show you a picture. Let me show you the item. You hold the item. What is that called? It helps hold the food in a small bowl. What is that called? It's called a spoon. Like that. It takes time. It's a journey. But working on things like this, the whole idea, right, is that you are telling the brain, oh, no, I need to be able to speak. I need to be able to say these words. Your loved one needs to challenge himself or herself to be able to do these things in ways that are sometimes hard and frustrating. Worksheets that you can go down a list of items. It's kind of tedious, but you can use pictures. Like I mentioned, you can use family pictures or items around the room. Anything where you can get into a scenario where at first you're going at quite a slow pace, and then you pick up that pace as the patient or your loved one gets more accommodated to faster and more precise speech production. So at first it might look like, I know I'll use my example of working in a hospital. What is that on your wall? What is that? Well, it's what you use to tell time. Good job. It's a clock. Oh, great clock. Okay, what is this on my hand? I got it whenever I had a proposal. What is this? Great, ring. Okay, what is that behind your head? It helps hold your head. It's comfortable. It's called a great pillow, and you do that. Or you have a worksheet and you go down that worksheet with pictures, or you have a scrapbook or a photo board and you go through the pictures in similar fashion. Who is this? It looks like a great party. What is that party? What were you celebrating? Oh, there's a cake. What is that cake? It's a birthday cake. Great. So you get the idea of how to use these very simple strategies: phonemic cueing, functional cueing, facilitating gestures so that that person has a way to ask for things, using a picture board so that that person has a way to point and request things, and then also allowing your loved one to speak freely without too much interjection, so that you're not speaking for your loved one. You're helping to facilitate more fluent, cohesive, precise, and appropriate speech. So that's enough for today, certainly. And we'll talk more about different parts of the brain and things that we can do to improve alternative deficits like comprehension of speech, memory. That's a big one because it's in so many different areas of the brain. But for today, I'll stop. If you have any questions about what I've covered, or you want to dig deeper, you feel like you need resources or further discussion, please use my email. It's the email of the Storyteller and the World, and I will get back with you. In addition, there is a resource PowerPoint that is uploaded to the website that corresponds to my talks. Today, you can look at slide 17 and 18 to get an idea of the anatomy that correspond to my talk. Thank you so much for listening. I wish you all the best, and please keep following us and supporting us at the Storyteller and the World. Good day.